in an homeopathic letter. Today's topic of discussion is conium maculatum. Okay, conium maculatum is one of my favorite drug and we oftenly used in our clinical. Importantly, you should remember 3 points regarding conium clinical tips. That conium is indicated mostly in the case of breast lump and causation and effect. Cause and effect relation you should remember, so that conium is best indicated. Conium mind is, if you find anywhere conium mind, then nothing do other symptoms, just give conium and feel the extraordinary result of conium. So without further delay, we will discuss about the competitive preparation. What are the points you should remember about conium? So conium, hemlock poison umbelliferae family. So first thing is that balm of Gilead. What is balm of Gilead? Balm of Gilead is a term which is previously used in the that is old maid or old person who are unmarried. This term is used in the English people, that is balm of Gilead. So balm of Gilead means the old maid or old people during or after climatery, means the person is unmarried or widow. These people after climatery period, then if anything happen to the disease of that person, then we call as a balm of Gilead. And especially it is conium is indicated for the disease of old man, old maid, old bachelor, that is they having the rigid muscular fiber. You should remember what is rigid muscular fiber. That is their fiber is not like chubby, like not that chubby fiber. The fiber is rigid fiber person, because old maid, bachelor, they are more capacity, more power to do more things. That's why muscular fiber is rigid. Person with light hair and easily excited, you should remember that they are mostly important thing is about that they are easily excited, that is they are irritable, easily vexed, morose. These all points of a mind. So they having light hair and rigid fiber, they are easily excited. These are the constitution of the makeup of the conium. Then debility of the old people, complaint caused by the blow or fall. Important thing is that the causation. If any complaint person during case taking says that I am suffering from fall from the road accident before 10 years, now the complaint is started, then conium may be indicated, because conium used as a long ago injury like blow and fall, like our lidompal hemamalis, like that our conium. Here the comparison point is that hemamalis and our lidompal, these are the long years ago injury if occur, then in your hemamalis there will be in the injury particular part of the injury, you can see bracket, there will be written conium. So that is the thing, complaint caused by the blow and fall. You can understand that long years ago if any injury occur, patient cannot be can say this, but if you think that this person is conium, first for more percentage of accuracy of conium is or no, you should ask the person. Okay. And then important point is that the cancer and the scrofulous person with endless gland, that is the endless gland or a scrofulous diathesis is present conium mostly. That is the important point. That's why in the mammary cancer or mammary adenomyosis or mammary lump formation, there will be, we can in that is in the male prostate and in the female mammary gland mostly affected if occur. Empirically we can think conium. Okay, you can understand. Then no inclination for business and study, as the person is a unmarried one, that's why he remain as a sedentary habit, that's why not interest about the study. Indolent, because of the unmarried status, he becomes indifferent, takes no interest of anything. The memory becomes weak, unbearable of a mental effort, and again the morose means more sad, more vexation, that is quarrelsome, very much irritable. The person cannot these are person like they are not sit without any quarrel, they are always think about anyhow dispute should be created, or these person are very disputed manner, they always want to be dispute. That is the easily quarrelsome or irritable, easily vexed. That is the thing you should remember about mental. Morose, the 4 point you should remember: easily vexed, morose, and quarrelsome. That is the important point regarding conium, mental. These 4 point if you write, or examiner if asked in the mental, and you say that morose, easily vexed, quarrelsome, and our this if you say, then the examiner will be very much old people. They having the disease which having muscular fiber, and as old people having prostate enlargement, we oftenly see. That's why their prostate is enlarged, and leads to cancerous. In physical journal, there will be blow or fall occur in the old people, which leads to debilation. That's why the prostration, sweating occur even in a cleansing. Contradiction. That is the point you should remember. That is cannot bear to be contradiction, like oromate. Anything excitement if occur, it causes mental depression. Dreads of being alone. Okay, being alone, we know dreads of being alone, like coal, like nox, like bismuth, like arsenic, like that. They having dreads of being alone. It avoid the society. That is the thing. You should remember that the person dread, but he do not want to be remain in the society. That is the point you should remember. Now the point is that glandular, there will be scrupulous diastasis. That's why there will be mammary in the female and testicle in the male. Cancerous tendency. So in cancerous, you should remember that cancerous condition, we can hard lump is present, then astraceruben is a drug. Astraceruben is a drug. You can compare that this drug is most commonly indicated in the person who having cancerous tendency, more very marked increase, third grade. So if second gradely, we can think about here written that astraceruben is the most indicatedly indicate, and you can remember these things. Now the thing is that pain, there will be fibroadenosis. The clinical, what is fibroadenosis? Fibroadenosis means breast becomes sore, hard, painful, but the size may be increases, and the lump of the mammary increases or decreases during or before menstruation. You should remember that, like lacanum and calicum. Okay. Now the thing is that what is the modality of the person? Modality is that the person vertigo, especially on a lying down or a turning the bed. That is the vertigo, even slightest motion, like brownia. He do not want to be he becomes still, do not want to be movement. That is the important point. Must keep head perfectly still, so that, or the on turning left side, it also causes vertigo. So vertigo is causes due to the movement. Now the old people having ovarian or uterine complaint, they also having vertigo. Cough character is that there will be spasmodic cough, like a dry spot in the larynx, like acetic acid. So itching in the chest and the throat, odors in the night. That is psychosis, miasm is predominant. That's cough is more in the night time. Lying down or during pregnancy. So you should remember the respiratory system cough, that is lying down. The vertigo is also occur. In cough also, lying down aggravated the cough. Lying down, two things we remember, that is vertigo and lying down. There will be cough will be occur. 2 points about lying down. So you always remember about the lying down point of the conium. Now the thing is that as there will be prostate is heavy or gland is inflamed, that's why the difficulty in avoiding the urine. Flow become intermittent. Stop and again flow. The prostatic uterine complaint, that's why these things happen. Now the thing is that menses point, you should remember that there will be suppressed menses, too late, too scanty. Why this thing happen? The causation is always that old maid person mentally as well as in physically, the scrupulous diathesis, there will be hormonal disabilities. That's why too scanty, short duration. There will be red pimples will be occur, which can cease during flow. So you can remember the flow in menstruation. If asked, then you can write that in the menstruation concomitant, the breast lump will be increases or decreases, as well as the spot or pimples increases or decreases before and during flow. Now the thing is that flow becomes stopped by taking cold. If cold water or cold bathing will be occur, flow becomes like phosphorus. We know phosphorus, warm water, there will be nausea, vomiting. Similarly, in the conium, there will be cold water put in causes menses stopping. Leukorrhea 10 days after menses. You should remember this point, that is leukorrhea point is that there will be mostly indicated conium as a leukorrhea, because there will be characteristics it found that after menses leukorrhea starts, and during menses there will be no leukorrhea. You can think about conium like borax and bovista. Leukorrhea is very much acrid, bloody, like we know leukorrhea character: profuse, thick, intermittent, bad effect of a sexual desire. As they are old maid, they are bachelor, that's why there will be sexual desire is become so suppressed. That's why there will be suppressed menses will be occur, and the non-gratification of that indolence, which leads to many type of disease can occur. So here the aversion to light occur, and the inflammation of eyes, so that the by using the artificial light, like student in night work if occur, then causes photophobia, these things. And the important point you should remember, the sweat occur in day and night, and the sweat is very much marked. We cannot see in the clinically, there is no proving, but you can ask the patient that if he close the eyes, there will be sweating occur. These things we can characteristically found in the conium. Now the relation is that alcoholic or conium person is in alcoholic person is improved to from alcoholic wine abstinence, then we can give conium. Now the thing is that Annika Rostock's in the constitution, as blow and fall will be injury can be occur in long years ago. That's why Annika and Rostock things we can found. Then asterisk in cancer, and calcarea and phosphorus in glandular. So in calcarea carb, you should remember the calcarea carb there will be lump is very soft. In calcarea soft, the intermediate lump means softness is low, but in conium there will be hard lump. Okay, this is all about the conium. Thank you.